My name is Ryan Everett. I work as a Director of Population Health for the Ohio Hospital Association. I thought it might be helpful to quickly tell you what the Ohio Hospital Association is, because I imagine many of you might not know that. I didn't know who we were before I started working there. So essentially, we're a trade association for all the hospitals, so we're a member-based organization. All of the hospitals in the state of Ohio are members of OHA. So we do multiple different things. One piece is advocacy, so we advocate for hospitals on things like legislation and policy and regulations. We work with Medicaid on things like reimbursement with the managed care plans and things like that. We also do quality and patient safety, and one of the pieces of our work in that area is around infant mortality and maternal health. And so I kind of lead our work on the maternal child health portion of that. We have many different components of that work, one of which is our breastfeeding promotion and our First Steps program. So that's kind of where our organization fits into this and how I kind of got to be where I am. First big test. All right, so I'm here today to, no, that's not why I'm here. Sorry. So that's, I always like to, all right. So I will say, I'm used to being at these kind of conferences. Go to another conference, the Olka Breast Fest, for those of you who have been there. We don't even get a bathroom there, so I have to struggle. So I'm used to being the only guy in the room. I think I may have seen another guy with one of the World Breastfeeding Week shirts on, so kudos to him wherever I saw him. So, but yeah, so I'm here today to just do a little bit of an overview of some of the statewide work going on around breastfeeding promotion. I'm a self-described data nerd, so I brought some numbers and some data as well to kind of talk about some of the breastfeeding rates and things that are going on in Ohio. And then the latter half of my presentation, I'll be talking about the First Steps program, just talk more about that. So that's just an agenda. I'll let you can all read. But I won't go through all of that, just kind of walking through the things that are going on, how the program came to be the First Steps program, what we've been working on, how it's working with the hospitals. And yeah, so I'll go ahead and get into it. So before I get to the data on where we are, I kind of thought it would be helpful to start with where we want to be. So I threw up some data from some of our statewide targets around breastfeeding. So the first two being from the Maternal Child Health Block Grant from ODH, and these mirror the Healthy People 2020 goals. So we set our goals that we want our percent of infants who are ever breastfed to be up to 81.9% by 2020. Our percent of infants breastfed exclusively through 6 months up to 25.5%. And then there's also the Ohio Chronic Disease Collaborative, which I'll talk about a little bit later, which is a subgroup within, it's kind of a global work group here in Ohio, and we set a goal of increasing the percentage of babies who are breastfed in the hospital setting, and that's kind of helped transition into the First Steps program. So I wanted to start there. Another piece of all of this that some of you may have heard about when you hear about all these acronyms that happen at the state level, there was the SHA and the SHIP, and all that work at the state level in planning. So if you work with your local health departments, you know they have to do their community health assessments and figure out what's going on in the community, what we're going to do to deal with those issues in the community. Hospitals have to do the same thing. They have their community health needs assessment, and the state also did theirs as well. So in the state health improvement plan, they set goals specifically around breastfeeding. One of the strategies being to continue to support the Ohio First Steps program for healthy babies. The goal they set was to increase the number of hospitals participating to 67 by 2019. We reached that goal like a year ago. So we're having a lot of success there, so that's great. I'm sure as we move forward with the SHIP, we'll keep looking to set that number higher and keep increasing the work there. And I think what was most exciting for me to see our program and some of this get included in the SHIP at the state level was the strategy at the state level is reduction of infant mortality. And so to have these called out initiatives around breastfeeding just shows the value that the state sees in breastfeeding as an infant mortality reduction strategy. So I thought that was really exciting to see in that work. So now to kind of jump over to the actual data. So this is data from the National Immunization Survey. So it's a little bit delayed. So this is one of those call and bother people at their houses and get them to fill out these surveys. So you'll see Ohio is traditionally, we've been lower than the national average, but we have been moving and increasing and getting closer to the national average at a pretty fast pace, which is exciting. And the 2015 data, which just came out recently, We just updated this slide. We're almost at the national average, so that's really exciting. And our rate for 2015 was actually 81.9%. Which, if you remember back to 2 slides ago, is actually the Healthy People 2020 goal. So we've actually hit the Healthy People 2020 goal for this metric in 2015 for Ohio. So that was exciting to see. Obviously, we'd love for that blue line to jump above the red line, so we're working on that. The next slide, this is breastfeeding at 6 months. So again, from the same survey. So still a little bit lower than the national average. Our rate in 2015 was 53.1%. And you'll see the national was about 57.6%. So we're still lagging a little bit. This spaghetti plot is a bunch of different metrics. So the top line there is Everett breastfeeding. The red line is breastfeeding at 6 months. The purple line in the middle is the exclusive breastfeeding at 3 months. The green line, breastfeeding at 12 months. And the bottom line is exclusive breastfeeding at 6 months. So you can see how, in general, all of our metrics, we are kind of moving in the right direction. We've still got, obviously, a lot of work to go there. One of the other metrics there, the exclusive at 6 months, we're at 23.7%. We're getting close to Healthy People goal, but we're still not there yet. So we've got some more work to do to continue to get our rates improved there. Some more numbers. So this is the Ohio Vital Stats data. So recently, we added some measures in the birth certificate data to track breastfeeding at the hospital. So any breastfeeding at discharge, and exclusive breastfeeding at discharge. So these are some of the data. We don't have a lot of longitudinal data because it is a newer piece of information that's been tracked. So you can see our rates have been improving a little bit. We didn't have an exclusivity measure for 2015 because this is really hard data to collect, and there's been kind of a learning curve to get used to collecting this kind of data. So there was a lot of missing data, and it wasn't very valid. So we're working to keep these numbers moving up. So that's just to show you kind of where we are looking at the vital stats data. This one's kind of hard to go through, but if you know anything about the PRAMS data, which is another source of data, this is another surveyed out data that the CDC used to do for Ohio, so Ohio participated in for several years, this survey, and recently they created the Ohio Pregnancy Assessment Survey, which was done through OSU and ODH and Medicaid, in surveying out to moms across the state to see a bunch of different things, anything from prenatal care, to postpartum care, to birth control, to smoking, to tobacco use, to breastfeeding. So there's 106 questions, I think, that are on that survey that people fill out. And so this is just to show the red bars are national data, the blue bars are Ohio data. So you'll see in 2016 we have Ohio data, the national data is not out yet. The reason I put this up here is just to show both national and Ohio data is improving on both Everett breastfed and breastfed at 8 weeks, which are the 2 measures that they have in that survey. But when I look at the linear trend going forward, we're actually moving at a little bit faster pace in our improvement than the national data, so that was exciting to see. I'm almost done with all these data slides, I promise. We'll get through this together. One thing that I think is very important to talk about too is the disparities that exist when we look at our breastfeeding outcomes. So our percent ever breastfed, you'll see we've got about a 10% difference between our non-Hispanic white and our non-Hispanic black rate, which would be the purple and the blue on either end, this Hispanic rate being in the middle. And then on the far right, we have our percent exclusively breastfed. So this is, again, vital stats. So all of this is within the hospital. So this is breastfed anytime during the hospital stay and exclusively during the hospital stay. And you'll see that disparity. It becomes about 20% between non-Hispanic white and non-Hispanic black when you look at the exclusivity rate. So I wanted to mention that as well. And again, looking at the OPOS data, so this is, again, the survey data for 2016, you'll see the red bar is Ohio overall for Everett breastfeeding. Ohio non-Hispanic black is the teal, kind of the second bar there. The third bar is non-Hispanic white, and the fourth bar is Hispanic. So you'll see our Hispanic breastfeeding rate is actually the highest here in Ohio for Everett breastfeeding, and you'll notice a disparity again that exists. What's interesting is when you look over at any breastfeeding, it's 8 weeks. The one thing that I find kind of interesting is our Hispanic rate, which was our highest ever breastfeeding rate, goes down to our lowest rate. And again, you'll see that we have a disparity between our non-Hispanic white and non-Hispanic black as well. So I think we need to just keep in mind when we think about all of our work globally, if we want to achieve, we need to achieve equity in kind of these outcomes if we ever want to start to work on achieving equity in our kind of our infant mortality outcomes in general, and as we think about our maternal child health outcomes across the state. So to quickly mention that data set, if you I mentioned this for some of you who may be in Cuyahoga, Franklin, and Cincinnati. Those different communities, they oversampled when they did this survey. They oversampled in those communities. So if you're in Cincinnati, Cleveland, or Columbus, you can actually look at those measures specific to your community. So you can look to see what your rates are, and you can break it down by race and different things like that. So just to highlight this, I just spent this afternoon, they just did the statewide public release of this data this morning. So you can look, and there's a ton of extra data. So even if you just wanted to learn about your communities and a bunch of other different ways, that data is all free. You can go and look at it. I think these will be posted later, so you can use that link and go check out on that data. So now that we've talked about the data, kind of wanted to talk a little bit about what we're doing here at the state. So I'm going to start with several things that are going on at the state level. Most of these things aren't things that I'm doing as OHA, but I'm going to share them. Bree's going to yell at me, but some of these are things that Bree has more information, Bree Haviland at ODH, than I do. So I'll direct to her if we have too many questions. But what's being done, so the Ohio First Steps, which will be what I'll talk about here in a couple minutes. We added, as I mentioned earlier, the exclusive breastfeeding and hospital discharge question to the birth certificate. We've done all sorts of sessions to train birth clerks and others on how to collect that data appropriately so we can use it moving forward. And that's still admittedly a struggle, I think, statewide on how we collect that data and use it. ODH hosted statewide kangaroo care trainings, which reached, I think, about 92 or so hospitals. So we had hundreds of staff across the state who were trained in the kangaroo care. We have the Appalachian Breastfeeding Network, which is doing a lot of great work. I think we're hoping to be at their conference. They've got a conference coming up later this year that we were invited to, so hoping to be there to be a part of that. They're doing a lot of great work. There's been some work around piloting a 24/7 breastfeeding hotline, so rather than just a warm line, and some of the hospitals have kind of just the warm lines that are there when there's an IBCLC in the hospital, but there's not really anybody to talk to if there's nobody there. So there's a lot of work going on there. Still work to be done. I know they've been piloting it in different areas and piloting in Appalachia, but hoping that we can make some more progress on that. And then some new child care licensing rules, which is not my area of expertise, so I will not belabor that point. And then the maternal child block grant strategies. So again, a lot of these are the same, building up on the First Steps First Steps program, establishing the hotline, which is still in the works, addressing the disparities for African American and Appalachian women, increasing community awareness, creating public awareness campaign, and establishing a designation program for child care providers. So these are all strategies that ODH at the statewide level is looking to implement in the next block grant cycle to encourage and promote breastfeeding. So again, these are things that aren't, I'm going to talk about the First Steps program. These aren't things that are all within the First Steps program. These are things that are happening more globally at the state level. Another group for those, many of you may be aware of this group, but a group to let everybody know about in case you want to get more involved at the state level is the Ohio Collaborative to Prevent Infant Mortality. They created a document which was the Ohio Infant Mortality Reduction Plan, which is really their strategies on how they hope to reduce infant mortality in Ohio, and they break this out into several action groups. And two of the action groups have specific focus called out in their work around breastfeeding. So one is around infant health and one is around maternal health and women's health. So if you do have any interest in getting involved with that, you can either talk to myself or I've got the website is linked there. And I'll talk a little bit more later about a conference that they're putting together, which will have some focus around breastfeeding support as well. So that's another kind of statewide group. It's free to participate. There's quarterly meetings and phone calls and action groups, things like that. So now the Ohio First Steps programs. This will all be First Steps from here on out. And to try to get everybody's attention refocused here, there's cake. So we'll just it seems like something fun to get everybody excited. So that was actually a hospital who was celebrating that they were recognized by the First Step program. They bought their entire maternity unit a cake to celebrate. So did not expect that I'd ever see our logo on a sheet cake, but you never know with that kind of stuff. So quick acknowledgments. Obviously, Bree Haviland at ODH, she's my colleague in all of this work. She left me for a little while on maternity leave, and I was very sad because I had a lot of work that I had to do by myself. So happy that she's back. And then we have our First Steps Review Committee, which is made up of folks from all across the state, from baby-friendly hospitals. We have pediatricians. We have folks from the Ohio Lactation Consultants Association, the Ohio Breastfeeding Alliance. So we have a slew of expertise they all volunteer their time to this program. So they all have their jobs at their hospitals, but they still take time on a regular basis to meet with us and work on the First Steps program and come up with ideas on how we want to make the program better. So without them, we wouldn't be able to do all this great work. And also, I wanted to show he's the face of First Steps, so that's Bree's baby Mason. So we actually used him in some of our promotional material, so he's officially the face of First Steps. So I had to put him up there too, because he's just adorable. So, so that's baby Mason. So the history of kind of how the First Steps program came about. While the First Steps program isn't really new anymore to me, it's been around for several years. It's still new, I know, for many individuals who aren't directly involved in the hospital side of the program. The program's actually a result of many years of collaborative work across the state. So several years ago, the state organized the Ohio Chronic Disease Collaborative. One of the objectives of this group, as I mentioned earlier, was to increase the percent of babies who were breastfed at the hospital. And among the strategies to achieve this objective, one of them was to establish an Ohio-based program to recognize birthing centers that meet all or part of the 10 steps to successful breastfeeding. And so that ties with the World Health Organization, the CDC, and or the baby-friendly 10 steps. So essentially establishing a program that would recognize hospitals for working towards that. So a breastfeeding work group was then formed to execute the strategies identified in the state chronic disease plan. And in mid-2014, the team began working to adapt a program from North Carolina that recognizes hospitals for implementing these best practices. While the First Steps program is based on a lot of the same, it's based on the 10 steps from World Health Organization and Baby Friendly. Our program isn't designed to replace Baby Friendly. That's the evidence-based program for recognizing hospitals for breastfeeding promotion. So we're not out there to try to compete against Baby Friendly. Our hope is that we can provide hospitals the resources and the education and things that they need to work towards that. Becoming baby friendly is very expensive for hospitals. It's very labor intensive. Unfortunately, here in Ohio, we've actually seen a lot of hospitals who have chosen to not redesignate, and most of the ones I've talked to, it's because they have trouble getting support to keep the resources involved to stay baby friendly. And so the hope is that we can help fill as many of the gaps needed to help hospitals get to that point or stay at that point. So our program, for that same reason, it's a modified and more simplified version of that process, allowing hospitals to be recognized for their work on their maternity care practices, support breastfeeding as they're able to do so. Because research, as we've seen, has shown that there's a dose response to the 10 steps. So even if a hospital is doing 5 of the 10 steps, it's likely more beneficial to the patients if they're not doing any of the 10 steps. So we want to encourage them to, at whatever stage the hospitals are, we want to be helping them move up in those steps. So ODH and OHA had a long history of working together on projects, so it kind of made sense for us to come together and put this program together. So that's kind of how the First Steps program started. So leveraging the chronic disease breastfeeding work group, a team of experts from across the state were assembled to serve as the review committee. As I mentioned, we've got folks from OCA, OBA, the American Academy of Pediatrics in Ohio. We have state agencies. We have folks at baby-friendly hospitals, non-baby-friendly hospitals. We've got lactation consultants, dietitians, pediatricians, me, and we all get together on a regular basis to talk about the program. So we officially launched in 2015. We did a big informational webinar, press releases, all sorts of things to get the hospitals up to speed on what we were doing. We've got 2 websites, because you can't just have one website. So we've got 2 different First Steps websites, one from OHA and one from ODH, where the hospitals can pick up all the resources that they need around the program. Additionally, we were able to obtain some federal funding from the Association of State and Territorial Health Associations to support this work. So a lot of what I'll talk about over the next couple slides in our different, they're kind of chunked out by year, and the reason we talk about it that way is we had annual grant cycles that we use, so I'll kind of talk through kind of each grant cycle. So we were very thankful to have that support, because it really was helpful. I think, as I understand, a lot of some of the WIC folks, you've got the flip charts or some of the posters that we put together. So a lot of the development of those materials were done through this grant funding that allowed us to get a designer. It allowed us to use our time and resources to put those things together. So a lot of that wouldn't have come about if it weren't for that funding that we were able to obtain. So that was great. And so to give a little bit of a baseline, because I've got to throw data in here every once in a while to keep myself focused. There's a CDC survey that goes out to hospitals. So similar to how we survey patients or families at home and say, what are you doing? There's also a survey that goes out to the hospitals, and it's called the MPINC. And that survey basically surveys hospitals on what their practices are around supporting breastfeeding. And so it is breastfeeding specific. All the questions are only about that. And so Ohio actually, in the last survey was 2015. They're actually revamping the survey, and we're hoping that it'll be out in the next year, and we can get this going again to have some more data. But Ohio was constantly, this was, 2015 survey was the last one. So this was kind of all before First Steps. This is kind of showing where Ohio was going right as we were kind of starting this program. So we were seeing our rates improve. We actually were ranked 22nd. So I know if you look at a lot of the infant mortality data or a lot of the public health data around Ohio, oftentimes we're towards the bottom of the barrel on a lot of things. So it was really exciting to see for once we weren't at the bottom of the barrel. We were actually ranked relatively well relative to our other states on this score. So we were we were seeing the hospitals, the scores out of 100, so 80 out of 100. Our higher score dimensions were around breastfeeding assistance, feeding and breastfed infants, labor and delivery care. Some of our lower scores were staff training and hospital discharge care. The staff training will become relevant in some of the future work that we've been doing and how we've kind of decided on where to focus our work. So we're hoping as we move forward and we do more of these scores, we'll be able to see Ohio scores moving up as well. So back to the first steps. In our first year, the first thing we did was kind of just creating our application, our review form. There's kind of a lot of the behind the scenes work that needed to happen in order to create a statewide recognition program. We created a resource guide for hospitals, which was it's a PDF document that's several pages. It's just links to things like free education for your hospital staff, examples of policies to implement at your hospital, resources for fathers and other support, folks in the family, all sorts of different things. We keep that updated on a regular basis. We posted that to our websites. We also did some work on improving the quality of the birth certificate reporting, so we partnered with the Ohio Perinatal Quality Collaborative around that project, and we recorded that and we posted that as well. And then we started creating our promotional materials. So what you'll see there is our 10 Steps poster. So most of the hospitals at this point in time, we've got our 10 Steps posters shared, so they can have those up and hanging in their hospital so their staff are aware that that's something that they want to work on. And so, year one was kind of getting everything set up and ready to go so we could get the program moving. So in year two, ODH hosted the free trainings for hospitals. So this was the kangaroo care that I mentioned a little bit earlier. So they had 21 workshops across the state. They had about 391 staff representing 92 different hospitals who attended those kangaroo care trainings. And we were able to leverage the First Steps program to get more hospitals engaged with that program. I've got a listserv of about 150, 200 folks from hospitals across the state who all just get information specifically around the First Steps program from me. So we leveraged that networking. We also partnered with the Ohio Lactation Consultant Association, the Ohio Breastfeeding Alliance for a bag-free recognition. So this is something that they had done for several years through a partnership. And from what I understand, when they first started, they would call all of the hospitals and ask, are you giving out bags of free formula to the parents from the formula companies? And the goal obviously being that they're not doing that. And at the time, there was like 4 or 5 hospitals in the entire state. We've got about 106 maternity hospitals. So years and years and years ago, everybody was giving out formula. And so we did this program, and we relaunched it kind of in 2016 to see where we were. In the first year, so we did this at the OLCA BreastFest conference, so in 2016 was the first year we did it, so it would have been reflective of practices in 2015. We had about 52 hospitals that applied. In the next year, we had about 59 hospitals that applied, and then in this most recent year, we're up to about 73 hospitals across the state who have gone bag-free and chose to be recognized in that program. And because it's voluntary, it's a voluntary program. We can't say that's 100% reflective of. There's probably other hospitals that are maybe doing that as well, but we know of at least 73. So we're very excited to see that. We'll be doing that on an annual basis again with annual recognition to get the hospitals working towards that. A lot of hospitals are using this twofold. One is an opportunity to reach out to their clinics, or their affiliated clinics and their OBs to be like, hey, this is something that the hospital is choosing to do. We also don't want you to be doing this, because we're finding even if the hospital is bag-free, a lot of their clinics are still, the OBs out there are still handing out these formula bags. And so a lot of hospitals are using it as an education opportunity to go out to their hospitals. And the other hospitals are using education as an education opportunity to their leadership to say, hey, look how many hospitals across the state have made this decision. And I think we need to make this decision at our hospital. And so this provides an opportunity for them to say, look at what everybody else is doing. This is the best practice. This is something that we want to do at our hospital. Also looking at year 2, we supported a conference that was titled the First Annual Conference to Eliminate Racial Disparities in Breastfeeding and Infant Mortality. So this was a conference that was held by Cincinnati Children's Medical Center. At the time, it was just a local conference held in the Cincinnati area. We were lucky to have some funding that we were able to use there to record that conference. They had featured Dr. Michael Young of Howard University. She came and spoke, and it was a great presentation. I was lucky enough to be able to attend before it sold out. And we were able to support that. They've done it again. They did it last year and sold out again. And then this year, they've expanded that into a statewide conference. So it's not just Cincinnati focused anymore. It's the 3rd annual this year. It's going to be in Cincinnati on December 11th, and I'll touch a little bit on that at the end of the presentation. But that'll be a great conference if you're interested in attending that. It'll be a day-long conference around breastfeeding and around eliminating the disparities around breastfeeding, and it'll be in Cincinnati again. And we also presented at this session at the 6th National Breastfeeding Coalitions Conference, which was a USBC conference. So I think we just submitted an abstract for a poster, and then they actually came back to us and asked if we would present a session. So I think one of our pediatricians from Cleveland actually went out to the USBC conference and presented about what we were doing with the First Steps program for us. And that poster that you can't see because it's super, super tiny is just a poster we put together of kind of all of the work that we've been doing at the time, and we took that to some different conferences and things like that, and so we'll be updating that this year for a couple other conferences we're going to. Also in year 2, we produced a couple of our first materials across the state, so some of these may look familiar, hopefully to some of you, if you've seen them. We distributed about over 1,000 of these materials to about 75 hospitals who asked for them. So the first being the Breastfeeding for Breastfeeding. This is the flip chart resource. So if you do have this, awesome. If you would like more, I unfortunately don't have any more hard copies, but everything that we ever put together, we put online for free. So if you ever wanted to print off copies, even if they're not the fancy, nice bounded ones, all of them are free online. So we don't try to hide any materials from anybody. We also put it together. One hospital asked to use it as a PowerPoint because they wanted to cycle it through in their waiting room. So they actually just cycle through the different pages of the flip chart in their waiting room. So we also put that together as well. We put together a poster, which is broken into a couple sections for the importance of breastfeeding for mom and baby's health, skin to skin, rooming in, feeding cues and stomach size, and latch. And so some different areas on that poster. So we've got large and small versions of that we sent out to the hospital, and that's also available online. And then the last piece we put together was kind of a resource that hospitals could use if they want to that talks about so the 10 steps is really a hospital thing. It's, do you have a policy in place? Are you educating your staff? It's not a patient thing. And so we put together a resource for patients to kind of say, if I'm a patient going to a hospital who's working on those 10 steps, what does that mean for me? How does that change my encounter with the hospital if it's a hospital that's really focusing on skin to skin or rooming in, and had, kind of a resource to help guide hospitals in those conversations. So that's another resource that we put together. And then year 3. Our focus of year 3 was kind of we wanted to do a lot of education calls, so coaching calls and education calls for the hospital. We held monthly calls starting in November 2016. Our first call was related to step 3. In January 2017, we did a call around improving exclusive breastfeeding rates, which is something that all of our hospitals are struggling with. Even some of our baby-friendly hospitals struggle to keep their exclusive rates high. So we brought in a couple hospitals who were having good success in seeing their rates really improve and sustain. So we brought them in to share what they were working on. In February, we held one on the disparities in breastfeeding. And we brought in Ms. Kimmery Bug from Atlanta from a group called Reaching Our Sisters Everywhere, Rose. And so she came and did a presentation for us. In March, we did one around Step 2 in Skills Lab and helping hospitals identify ways to educate their staff and how to host a Skills Lab with their staff. April, we did data collection, which was again tied partly to the birth certificate data, so helping hospitals collect that data and how to do things like maternal interviews and some of the different things that are required for baby-friendly and some of the other pieces that have data collection involved. In May, we did one that was kind of interesting and different from what we've seen a lot of partners doing, which is, not May. May, we did leadership and staff engagement. In June, we did fatherhood and partner engagement. So we actually partnered with a program up in Cleveland and a gentleman named Steve Kilpack, and he does Father's Boot Camp program, boot camps for new dads. And so we partnered with him to put together some resources for dads. And so one of the things you'll see there is a card called I'll Be a Champion Dad. And it talks about how dad can encourage mom in her breastfeeding decision. And then some other pieces of the card, there's a little piece for if dad can't remember, like I would be bad at remembering this, like baby's weight and size or whatever. There's little pieces of when they were born, what time they were born, some different things. It's designed to be a little wallet card that dad can keep in his wallet so he can brag about his new baby. And so we put together those cards as well. And again, all of these sessions were recorded. They're all posted online for free. So if anybody wants to see any of those, they're all available, as well as the resource there. And so year 3 again, we did more materials. We expanded the reach of the materials we already had, so all those flip charts and posters. We got those spread out across the state. We put together a safe sleep and breastfeeding poster, so based around the latest AAP guidelines around safe sleep. We really wanted to make sure that it wasn't new moms hearing safe sleep in one conversation and breastfeeding in a different conversation, and how it needs to be part of the same conversation. And so we talked about sharing the room and not the bed, and then just kind of what safe sleep is, what are the benefits of breastfeeding, and tried to condense all of this together in one quick resource. We brought in a lot of extra partners for that. We brought in the American Academy of Pediatrics Ohio chapter. We brought in a lot of the children's hospitals. That was a project that was really kind of a lot of fun to work on because we had tons and tons of people who came together to make that come together and work. We did our fatherhood partner engagement piece, which I just talked about. We did a resource. A lot of hospitals really like the feeding cues and the stomach size resources that were in some of our posters and stuff, so we kind of pulled those out and made them their own resource. And then one of the other fun things we were able to do is, through the grant that we had, we were working with several other states who were doing similar programs, and a lot of states asked for us to share our resources, so we shared all of our resources out to all these different states, and Nevada came back to us one day and said, hey, can we translate these into other language, into Spanish? And we're like, yeah, that's fine. So they translated and sent them all back to us. So we actually have a lot of our resources in Spanish now, thanks to the work that they were doing. So that was really exciting to see. So unfortunately, we don't have any other languages yet, but right now we just have the Spanish versions of some of the resources. So that was kind of exciting. And then what are we up to now? So kind of our most recent work. And since I got to show off Breeze Cube Baby, this is my little nephew. He's adorable. He wanted a beard like me, so I bought him that little thing, and then he thought he was Santa Claus, so he's doing the ho ho ho. So what we did most recently in this last year grant cycle was we focused on step 2, and we tried to take a statewide approach to step 2, which is a requirement for hospitals to educate all staff who are interacting with a mom, and it's for most staff who are directly involved with mom's care, it's a 20-hour requirement for education around breastfeeding. And so the problem a lot of hospitals face is it's not cheap to do that. Most of these 20-hour courses are very expensive. Even if they're not expensive, you have to cover the time of your staff taking their own 20 hours to do this training. With high staff turnover, a lot of hospitals struggle to decide whether it's worth the investment of constantly paying for somebody to do these trainings if you know they're only going to be around for a certain period of time. And so even thinking back to the MPINC scores, we saw that one of the areas with the lowest score was staff education. And in surveys to the hospitals, we saw that when we looked at the steps hospitals were applying for, we always found that the staff education was the hardest piece. So we applied for a innovative grant, a competitive innovative grant through the same folks that we've been applying for. And we were awarded one of the grants out of 7 states that were awarded. So there were several states that applied. We were one of 7 that were awarded. And we decided to take a two-phase approach to the step 2. One was statewide regional trainings. So we decided one of the pieces of these education is an in-person training with your staff. So they call it a skills labs, essentially doing hands-on training with your staff at the hospital. And we decided a lot of times you have to bring in somebody to do those if you don't have somebody at your own facility who can train your staff to do that. So we decided to do a train-the-trainer style skills lab training so that hospitals can send one or multiple persons from their facilities come in to do this training. Then when they leave that training, they're skilled and trained to go back to their hospital and train their own staff. So now they've got somebody at their own facility who knows what they're doing to be able to do that. So we put together toolkits, we put together resources, we brought together some of our folks from our baby-friendly hospitals who lead these skills labs, and we've created their little binders that we put together for everybody in these big poster boards and stations and things, and we held 19 trainings across the state. We had over 200 attendees representing over 80 hospitals. And it was very exciting to see. We did all of them in the month of May. It was kind of a crazy funding cycle that just kind of was super fast, but we were excited to see how many hospitals turned out. The other piece that we're doing with that are some free online modules. So we partnered with the Maryland Department of Health. They put together these 15 one-hour modules around staff education, and we are posting those online. So ODH is hosting those, so those will be coming very soon for the hospitals. There's going to be CEs provided for those as well, so that hospitals can send their staff to that. They can do all of the training and the education for free online, get their CEs as well at the same time, and it's all tracked, and then hospitals can go back and even audit to see how many of their staff are doing the education that they need to be doing. So we're very excited about that. We're still wrapping up this grant cycle, but that's kind of some of the stuff that we've been doing. Upcoming work, we're making some updates to the recognition program. So in the past, we've allowed hospitals to estimate things. So a lot of the requirements on, say, how many moms are having baby rooming in with them 24 hours a day at the hospital. And you have to say what percentage of moms is that happening. So you have to hit 80%. And so we were allowing hospitals in the original part of the application, like I said, we were trying to be more simple and simplified in how we were doing that process. And so we were allowing estimates. And we heard from some hospitals, we really want to be a little more rigorous. We'd rather be chart abstracted or hand collected data or things like that to kind of prove that that's what you're doing. So we're removing estimates from that to kind of make the program a little more rigorous. We're also working on designing a bit of a data collaborative or kind of a QI program with the hospitals that might involve some benchmarking to say, we know what our rate of skin-to-skin is at the hospital, but do we know how that compares to all the other hospitals around us or all the hospitals in the state? Because we might know that maybe we're getting better, but we're still way behind everybody else. And so we want to work with hospitals to do a little bit of data collection and then maybe figure out if there's an area of opportunity where we really need to do a strict kind of QI process with the hospitals and how we can improve some of the outcomes around some of these breastfeeding pieces. And then, unfortunately, the funding stream that we've had for the last couple years is officially ended. And so we'll be looking for some future funding and just figuring that out. So these are all things that we're kind of looking at right now to figure out how we can keep the First Steps program moving forward. And I'll show you here in a little bit. We're very excited at where we are right now because we've really had a lot of great engagement with the hospitals. And so back to data. So for some of you, I'm sorry, we have to go back to the numbers. But this is overall Ohio participation in the program. So our recognized hospitals, we're up to I think we just finished round 13 of the quarterly applications. We have 81 hospitals of the 106. That number always kind of changes a little bit. I think we're at 106 right now. Maternity hospitals. So about 78% of the hospitals in the state are recognized with at least 1 star in the First Step program. When you add on hospitals that have applied for the bag-free recognition, so there are some hospitals that are bag-free, but maybe they haven't yet applied for the program because it's a little more intensive to either collect the data or whatever it is to be able to apply for the steps. So we jump up to about 89 hospitals with about 85% of the hospitals participating. And then when you tack on hospitals who are using the First Steps materials or have gone to one of the regional trainings or are otherwise engaged in kind of what we've been doing, we're up to pretty much every hospital. Like we've got 2 hospitals that we're still working on, but the goal by the end of the year is to get those last 2 hospitals fully on board. So we're pretty excited that pretty much almost every hospital in the state is engaged to a certain degree in the First Steps program right now, which is most exciting for me because it's a voluntary program. We don't, even though we're the hospital association and all the hospitals are our members, we don't mandate that they participate in these kind of programs. So the fact that many are participating hopefully shows that they're finding value in what we're putting together for them and sharing with them and all of that. So a little more on the data. Oh, I was right. So 13 rounds, 81 hospitals recognized. The other thing that's interesting is all of the baby-friendly hospitals also chose to be designated in the First Steps program. So even they are finding at least a little bit of value in that. And actually that number, since I did the slides, has gone up to 9. So we just found out a couple days ago we had another baby-friendly hospital designated just in the last, I think, week or 2. So that we're up to 9 baby-friendly hospitals in Ohio. We've had 54 advance in steps since first recognition. So what that means is they applied once, they maybe got 1 star, and then they came back later after doing some work in their hospitals and they applied for more stars. So 54 of those hospitals not only just applied once and then forgot about the program, but they applied and then they really went back and tried to make some changes in their hospital to be able to achieve more stars. So in general, we have 528 steps achieved of the 10 steps. So we're averaging about 2.5 stars per hospital, which is exciting. And then we've got our 14th round. The application will be on October 1st, I think is when the next round comes in. And then some other fun news. We actually also put together an abstract. We took some of our data that we've been collecting on the hospitals, looking at steps they've applied for, when they applied for steps, and tried to tie it to the vital stats data at ODH to see how participation in the program is reflected in changes in breastfeeding outcomes. And so we submitted an abstract to the American Academy of Pediatrics section on breastfeeding, which was accepted, and so we'll be, one of our pediatricians will be going to, I think, DC to go present some of our data. We've been working with some epidemiologists over at ODH, and essentially showed that breastfeeding initiation rates among hospitals achieving any one step versus non-participating hospitals were higher. So essentially, breastfeeding initiation was a little bit higher than hospitals who weren't participating. There wasn't a statistical significant difference, but it was still a difference that was seen there. An increased engagement in the program. So if you applied multiple times or you were more engaged, we did see also a little bit higher rate of breastfeeding initiation. And then they did some other sub-analyses based on number of births and locations and your OB level and all that kind of stuff, but I won't go too much into that data. So we were excited about that. Once that is finalized and published, we'll share that a little more broadly, and folks can look at the data to see. And we're going to figure out ways to continue to collect data and hopefully improve on that and see rates continue to go up. So more fun with numbers. I think this is my last number slide. So our most recognized steps are steps 8 and 10. So 10 being, hospitals sending folks back out into the community. Do you host anything at your hospital, support groups and things like that? Are you connecting them to the WIC, your local WIC? Step 1 being, your policy. Do you have a policy in place at your hospital? Least recognized steps are 6 and 2, so 6 is exclusive breastfeeding, and step 2 is the education piece again, which is why we really did all these trainings across the state. You can see only about a third of the hospitals who apply to the program feel that they're at the place to apply for step 2. And so I actually have a lot of hospitals who email me begging for the online modules to get posted because they're waiting to be able to reach step 2 and once those modules are posted and online. So, we track these numbers not just because I'm a data nerd, but because that's how we decided that's what we wanted to use our federal funding on. We saw step 2 was our issue in Ohio, and that's what we wanted to focus on. So that's why we collect that data. Our First Steps webpage, since it launched in 2015, we had over 8,300 hits just on the OHA site alone. So it's hopefully indicative of people finding the resources valuable, that they're going in and looking for those on the website. And then, as I mentioned earlier, the number of states using the First Step materials. I know at least Ohio, New York, Texas, Nevada have all reached out to me specifically to use some of our resources. So that's been exciting to see that the work that we've done has been valuable, not only to Ohio, but other states have been kind of impressed with what we've done and have asked to be able to use those things. How to get involved. Anything that we've done, so the First Steps program, while it is a hospital-specific program, most of the resources we put together, most of the education sessions that we've held can be more broadly useful to everybody. So we hope that anything that's posted on there isn't just useful for a hospital. Most of the resources hopefully can be helpful at the WIC clinics and other areas. So we do hope, you can always come check out the website. Hopefully there's something there that could be valuable to you. Like I said, all the webinars are recorded, all the resources are free. There's no password saying you have to work at a hospital to come and look at any of this stuff. It's all up for everybody to look at. And if you know anybody at, we try to stay engaged as best we can with the hospitals, but sometimes, folks in the community are a little more connected. So if you ever talk to somebody at a hospital and they're saying, oh, I heard about this program, I'm not sure, maybe there was staff turnover, otherwise, you can always send them to us, and we're happy to help get them either back on board or get engaged. And my contact, I think, will be on the last slide there. And the last thing I added real quick was recently the CDC, some of you may have seen this, I think this came out last week or a week or two ago, the CDC released their latest data around breastfeeding, their CDC report card. And so I just wanted to share this one slide, because this is when you go to kind of the CDC website, this is the big infographic that they have up. So this is percentage of live births at baby-friendly facilities in it says data as of 2018. I think this is based off of earlier births, though I could be wrong. And so you'll see Ohio is kind of lighter. We're, according to their data, 16.5%. So we fall kind of on the lower end there. updated a little bit. We actually would technically we would probably jump up into the next segment if you add the changes since this happened. So again, we added a new baby-friendly hospital, which is a pretty big birthing center up in Akron. And so our number does jump up a good bit in the number of births that we have in baby-friendly hospitals. So again, we work to kind of improve this number. It is a goal kind of that we have with First Steps, is hopefully we can get hospitals to move up to the baby-friendly designation. But again, we struggle in seeing hospitals who are either not losing designation, choosing to not redesignate, or otherwise. So, and the other thing was, if we look at hospitals who are baby-friendly and are also 5-star recognized in First Steps, even though that's not quite the same, we get up to about a third of the births in the state, which is exciting. So, hopefully we'll continue to see these things move in the right direction. I know anecdotally of several hospitals who are working on baby-friendly, and hopefully we'll have several more coming here in 2019. And then lastly, there's another program that's coming out that called the Empower program, which is something that we might hear more about in your local communities, depending on which hospitals jump into that program. I tried to find out. They haven't yet announced which hospitals were picked, but it's a statewide kind of a collaborative group. That the goal of that group is to get hospitals to work together to get baby-friendly. We had 2 hospitals in the first round, and both of those hospitals have since become baby-friendly. I know of several hospitals in Ohio that applied to be a part of that program, and hopefully, if they're accepted, we'll have them moving towards baby-friendly as well. Again, as the last time I checked, they had not listed which hospitals were accepted, so hopefully we'll see a couple of hospitals in Ohio included in that program as well. And then I won't dwell too much on this because you probably can't see it, but this is a list of the check marks. So the check marks there are, these are all the Healthy People 2020 objectives around breastfeeding. You can see the check marks are where at the national level, the national goal has met the Healthy People 2020 goal. Here in Ohio, we've met 2 of those. So we've still got work cut out for us on reaching the goal. So again, as I mentioned, we hit the increase the proportion of infants who are breastfed ever. So we hit the goal of 81.9%. So that was exciting to see. And then we also hit the increase the proportion of live births that occur at facilities providing recommended care. Essentially, it's just saying live births at baby-friendly hospitals. So the goal that was set for that was 8.1%, and we're well above that as well. So we've hit those 2 goals. We've still got our work cut out for us around our breastfeeding rates at 6 months and a year, and then our exclusive breastfeeding rates. But we'll keep working on those as well. And then the last thing I wanted to mention was, in talking back to what I mentioned a little bit earlier, we've got 2 conferences coming around at the end of the year in Cincinnati. One of them is again, as I mentioned, the Eliminating Disparities in Breastfeeding and Infant Mortality Conference. Again, that used to be a local conference. Now it's expanded to the statewide level. The keynote speaker is going to be Dr. Kamara Jones. Who'll be coming and presenting at that conference. They'll have breakout sessions, poster presentations, and all sorts of things there. That'll be on the 11th. And then sharing the last plenary session on the 11th and moving into the 12th is the Ohio Collaborative to Prevent Infant Mortality Summit, which is saving babies together, meeting the equity challenge. So that one is a little more broad. There will be, I think, a couple breakout sessions specifically focused around breastfeeding, but in general that talks a lot more about infant mortality at a more global level, but those conferences are both kind of a little bit overlapped, but will be going on at the same location in Cincinnati. So if you're interested in either or both of those, the link for the Cincinnati conference is listed there, the OCPIM one. I don't know that a link is ready just yet, so more information will be coming out there. If your WIC clinic or anybody would like to share, I know they also just sent out the call for posters for the OCPIM summit, so that's open as well. So if you're interested in presenting a poster, let me know and I can forward that information to you as well. And I think with that, I think I'm finished. I'm not sure if Lori was going to come up or if we wanted to do questions first or wait till after. Or okay, I think we're going to do some questions then, maybe. Happy to try to answer any questions that anybody might have.
I wonder if you're tracking or discouraging hospitals from giving out those little 2-ounce ready-to-feed bottles of formula to breastfeeding moms, because we have them almost every day, breastfeeding moms coming in and then showing us the little 2-ounce bottles that they got from the hospital, and sometimes they're asking us for those.
Yeah, I'll have to look into that. I'm not aware of what those are, but I'm sure, I know like I said, we try to do the recognition for hospitals to become bag free. I know even some of the hospitals who are doing that, I know the issue they're having sometimes is that their affiliated clinics are the ones who are giving some of these things out, so it's hard to say. I don't know who is and isn't necessarily doing that. we unfortunately can't be in a position to force them to do or not do something, so we try to, hopefully, we're trying with these recognition programs to get people to stop doing those kinds of things. One other piece for hospitals that are looking to do the baby-friendly piece, the World Health Organization actually updated their 10 steps in the last couple months. And part of step 1 is being code compliant with the, I always forget the longer name for that, but essentially it's just not having marketing of substitution of formula, yeah, all the. So hospitals who are eventually wanting to become baby friendly, now baby friendly isn't changing their 10 steps just yet, but they've indicated that they probably will in the coming years. And so being code compliant, not passing out those kinds of things will become a part of the requirements for baby friendly, and will very likely modify first steps as well. When, we try to stay reflective of baby friendly. So if baby friendly were to change their steps to say you have to be code compliant, we would change that as well, so that would be something they have to do to be a part of the program.
You had mentioned there were 2 hospitals yet that weren't participating in the First Step. Can you share with us?
I probably won't say who they are because I don't want to shame any hospitals in a public space. That's not good for me. I'll get in trouble. But I will say in most cases it's not that a hospital is uninterested. A lot of them tend to be, the hospitals that are harder to get a hold of tend to be the smaller rural hospitals where you've got one person who's in charge of the lactation work and she's in charge of this, that, and the other. And at the end of the day, filling out a long application to get some recognition is not on the top of their priority list. And so, it's been, so essentially it's harder. We work with those hospitals a little more closely to try to get them brought into the program and see the value in it. I've already reached out to the hospitals who aren't, and both of them have shown an interest in being involved. A lot of them are their newer staff, or there's been turnover. I mean, that's something we face even with the hospitals that had been involved in 2015. There's some where I'm sure there's been turnover because I don't hear from them anymore. So it's always just a process of trying to keep up with everybody and getting everybody roped in. So we haven't had any hospitals that have said we do not want to be a part of it. So it's just trying to spread the word is kind of what we've been doing. So, yeah, we got one over here.
All right, we'll do this last question, and then we'll actually have a brief presentation from Lori Nestor at OBA. So this will be the final question. Thank you.
You could fill the whole time.
Is there any way to stop Abbott Labs?
I often joke, so I go to all sorts of different conferences, and I've gone to some conferences at the children's hospitals, and because of the nature of the children's hospitals, they often have some of these companies at the meetings talking about the things for the preemies and the NICU babies, and I always joke that I feel like my name's on a clipboard, like on a hit list somewhere, like behind the table of these companies, because I'm sure they don't like me very much, because I'm out here advocating against them a lot, but. So yeah, I mean, at the end of the day, I can't stop them, but I guess I sort of try. I don't know. But, well, I guess I'll turn things over to Lori.
My name is Lori Nestor, for those who don't know who I am. I work part-time for the Allen County WIC program as the breastfeeding coordinator. I did not have gray hair when I started working with WIC. Of course, that was 23 years ago, so maybe that had something to do with it. I wanted to give just a little bit of update for the Ohio Breastfeeding Alliance. We are the state breastfeeding coalition, and I hope that many of you are aware of who OBA is. As Ryan mentioned in a couple places, OBA has been one of the partner organizations working with Ohio First Steps and with some of their other collaboratives that have happened along the years. And it has been really amazing to see what's happened just in the last 5 years after a long time period of some quiet conversations in the various halls of ODH, after meetings. Some of our members and others who have been involved with WIC and other organizations have wanted to see this kind of a thing happen, and it took a number of years to get things going. And it's been amazing what Ryan from Ohio Hospital Association has been able to do much more quickly than often what we see happen through ODH. So he really has been an amazing gift to us, and we really have enjoyed working in a collaborative way with him. And I really appreciate him being here to give this update, even though he's talking about a lot of things that are happening in hospitals. I find it very helpful as a WIC person and a community person to know what's happening in the hospital, what information are they getting, what programs should they be aware of, so that when we're talking to our lactation staff or making other connections at our local hospitals, we can be asking about these things. And we can be, you can say, hey, what steps are you working on? Have you seen, did you watch the last webinar that came out and that was done? And it just helps, keep that community hospital connection going. And if you see people at the hospital level that say, oh yeah, I don't know about that, what is that? Or, no, we didn't get that announcement. It helps us to be able to kind of plug them in and get reconnected. Because like Ryan mentioned, you have staff turnover, changes in administration. All of a sudden, the emails are being sent, but who gets them? Who knows where they end up? So, I really appreciate having that connection to what's happening in the hospitals. On the slide here, we have listed our current board. We have an assortment of people from hospital settings, WIC. Some are La Leche League. We have a whole variety of people that are involved with OBA. One of the big projects that we have put together, and this is one of the places where everybody here can plug in and be involved. How many people here have their WIC clinic with information about your breastfeeding services listed on the OBA database right now? Not very many. All right, so your homework will be to go to the OBA website, ohiobreastfeedingalliance.org, find the database. At the base of the map, there is a link to click. You can add your information to that. This is a breastfeeding services database, so we're not listing who's IBCLCs and who's CLCs. We want kind of your basic information, and then if you have links to a website, if you have a phone number, a Facebook page, however people can find out about your services, we want that to be linked on the website. That way, as you update, as your location changes, your staff changes, whatever happens, that all gets updated at your end, and we're not trying to keep track of who's doing what. I know locally one of our hospital breastfeeding support groups has, they get moved around periodically, or their hours change, or, they're not meeting on such and such a day. So you can post all that kind of information at your website, on your Facebook page, wherever you want to put that. But we at least have the contact information and your location. This is a GPS-based location database, so we need to have an address so that it shows where you are on the map. And then from there, you can give directions, you can give phone numbers, you can put whatever information you would like. The ABN hotline uses this as an Ohio resource, so if they are referring moms, wherever in the state of Ohio, this is one of the resources that they use to help connect moms to breastfeeding services. We also want this something that, you can, give this website information to your doctor's offices, to your hospitals, whoever needs to have that, so that if they're working with a mom and they have a mom that needs to be referred to some services, that they have a good way to find kind of what's in their area. All right, just some, these slides are ones that were shared at the OLCA conference this spring, just highlighting some activities. In 2017, we had one membership meeting, and I believe that was at the Milk Bank. 2018, so far, we've hosted one membership meeting, and our tentative one that we're planning for the fall, I believe, will be November 9th. We are planning to meet at the Westerville Public Library, and we are starting to work on some agenda and some resources that we want to include for that meeting. So hopefully we'll get some information together here fairly quickly. We do continue to respond to individual nursing and public harassment issues. We have a PowerPoint presentation and a video that's up on our website, available for anybody to use if you would like to look at that and use it in any way in doing some training. We've conducted, as a coalition and with some local coalitions, we have conducted some trainings. We did a couple of trainings up in the Cleveland area. There was a mom at the Cleveland History Museum that was told by a couple of staff people that she couldn't breastfeed where she was, and that of course ended up on Facebook. And so the whole world is wants to pick it and have a nurse in, and you do the whole 9 yards. So we were able to reach out to a very receptive museum director. It was, I think, fortunate that she was a woman who had breastfed, so I wasn't trying to explain breastfeeding and nursing in public to a man who couldn't say the word breastfeeding, much less talk about breastfeeding, because unfortunately that's often the case. We have that available for anybody to use. If there are people that would like some information on some other tips or tactics to use, other ways to approach, if you have a local incident in your community and would like some help responding to that, contact us. That's one of the things that we've been doing. We love to partner with local coalitions or a local WIC office or people that are in the local community to help with that, just because then there's that one-on-one community connection that can provide for some follow-up and not be just somebody from a state organization showing up and talking to them. So we're happy to help with that. If you have other ideas for things that you would like to see in a toolkit, or if you have some handouts or some materials that you have developed and used, or strategies that you have used in your community, let us know. We would love to be able to feature that. Share some ideas, whatever you would like to do to kind of work on that together. And I think this will be something that we may do a push for in the next year. It seems like this summer there have been a lot of incidences in different places across the country of moms being harassed at the pool, at the mall, at wherever, the park, wherever they might be. And particularly in Ohio, we know that there's a state law protecting a mom's right to breastfeed, but wherever she otherwise is able to be. But I think kind of in the mind of the general public, I think that's kind of fallen off the radar. Certainly with employers, that has kind of fallen off the radar. We've had employers that, tried to discourage a patron from breastfeeding in the establishment. Once they were educated and told that, no, that's actually state law, they're allowed to do this, they're like, oh, okay, that's fine, I didn't know. And they're really, at the state level, there really doesn't seem to be much information about that law in materials for people starting businesses. So that's something I would like to see changed. There's information about the no smoking rules, but there's nothing about the breastfeeding. So there's a lot of people that may just not be aware and don't realize that what they're doing is actually against the law. So that may be something that we do more of a public, through public service announcements or other means, try to get that more widespread. We've sent representatives to the USBC National Coalition Conference each year, which has been really exciting to talk to people from other states and get information. And then I think Ryan mentioned the Child Care Project. OBA has been one of the organizations that's been a part of that. And that work is kind of just getting started, and I'm not sure they know exactly kind of what might come out of that. So one of the ideas would be to come up with a 10-step program similar to Ohio First Steps, but designed around childcare. So if you're interested in that, there's ways of kind of getting involved with that and being a part of that group, and hopefully we'll see some neat things coming. And yeah, so that's the work that's happening is now under the Early Childhood Health Network, and Bree could talk much more about that than I can. So I won't try to explain more of those details. We do continue as one of the organizations that's been involved in the Ohio First Steps, and it has been really exciting, especially talking about the bag-free hospitals, to see the energy and the momentum that has developed around that, because it's amazing to hear that happening, because so many hospitals have been afraid to go there. I have a display out in the gathering area that show our regions. I do have a list of local and regional coalitions that I'm aware of. If you don't see yourself listed on there, or if you are interested in starting a local coalition, get a hold of us. We would be happy to help work with you on that. I would like to see a group, kind of a listserv, networking group, kind of get together of people who are involved with local coalitions to share ideas and do some collaboration on their efforts. And that may be something that we spend some time with on at our meeting in November. I mentioned future project of doing some wider public awareness of nursing in public and employee pumping laws. We will continue to work with the child care projects or child care providers and the projects that come about through that. Anybody is welcome to join OBA. We have a $10 yearly fee. It's a fairly small fee. We don't have other funding from other sources on a regular basis. That's one of the things that we would like to find to maybe support some big projects. We are a 501c3, so if you have a local funding source through a hospital foundation or some other group that you want to apply to for some money, but you need to be a 501c3 to get the money, OBA is able to be a fiscal agent or a fiscal sponsor because we are a 501c3. And so we're working on developing some paperwork, some application forms, and figuring out what we need to have just so that that's outlined very clearly to be able to help local coalitions do work that they're trying to do. We would love to have more committee members we have application sheets in the back. There are a couple of committees there. We're also open to having just other work groups on different topics. And so we would love to be able to get some collaborative efforts going, linking people with some common interests, just even around coalition topics. If you are working with, parents that are involved in child custody issues and breastfeeding, incarceration and breastfeeding. There's a lot of different things. I mentioned our meeting in Westerville in November, and we'll have more information on that soon. And I think that's all I have.
Thank you, Lori. Thank you. That's a very